Introduction: Ceftazidime is a third-generation cephalosporin antibiotic used to treat serious bacterial infections. It is especially effective against infections caused by gram-negative organisms, including Pseudomonas aeruginosa. It is commonly used in hospitals for severe infections. 2. Class and mechanism of action: Ceftazidime works by inhibiting bacterial cell wall synthesis. It binds to penicillin-binding proteins, PBPs, preventing bacteria from forming a proper cell wall, which leads to cell death. It is bactericidal in action. 3. Spectrum of activity: Ceftazidime has strong activity against gram-negative bacteria, especially Pseudomonas, Enterobacter, E. coli, Klebsiella, and Proteus. Its gram-positive coverage is weaker compared to other cephalosporins. It is not effective against MRSA or anaerobic bacteria. 4. Indications/uses: Ceftazidime is used for severe infections such as pneumonia, urinary tract infections, meningitis, sepsis, abdominal infections, skin infections, bone and joint infections, and hospital-acquired infections including ventilator-associated pneumonia. 5. Dosage: the usual adult dose is 1 to 2 g given intravenously every 8 to 12 hours, depending on the severity of the infection. In severe Pseudomonas infections, higher doses may be required. Dose adjustments are necessary in kidney impairment. Pediatric dosing is based on weight. 6. Side effects: common side effects include pain at the injection site, diarrhea, nausea, vomiting, headache, and rash. Serious but less common side effects include allergic reactions, Clostridioides difficile associated diarrhea, kidney dysfunction, seizures, and blood count abnormalities. 7. Precautions: caution is advised in patients with a history of penicillin or cephalosporin allergy. Dose adjustment is essential in renal impairment. Long-term use may cause overgrowth of non-sensitive organisms. Monitor kidney function and blood counts during prolonged therapy. 8. Drug interaction: Ceftazidime may increase the risk of nephrotoxicity when used with aminoglycosides or strong diuretics like furosemide. It may interfere with certain laboratory tests such as Coombs test and urine glucose tests. 9. Contraindication: Ceftazidime is contraindicated in patients with severe hypersensitivity to cephalosporins. Use with caution in those with cross-sensitivity to penicillins.